All right, if you're a medical coding student, you are in exactly the right place. Today we're going to crack the code on two of the most essential CPT codes in behavioral health, 9791 and 9792. These are your go-to codes for psychiatric diagnostic evaluations, and trust me, by the end of this, you'll know them like the back of your hand. Ready? Let's get into it.
Okay, picture this. A brand new chart lands on your desk. Well, your virtual desk. It's a new patient, first visit with a psychiatrist, and the notes show a complete workup. You know right away, okay, this is a diagnostic evaluation. But that's just step one. Now the real work begins. Which code is the right code? So, yeah, where do you even start?
Here's our game plan. First, we'll nail down what a diagnostic evaluation actually is. Then we'll get to the big question. Was it with or without meds? That's the core of it all. After that, we'll cover the key reporting rules you have to know. And then we'll look at the common mistakes to avoid so you don't fall into those traps. Finally, we'll wrap it all up with one core principle that's going to be your guide for everything.
So, first things first. Before we can even dream of picking a code, we have to understand what we're coding for. I mean, what is this service? Getting this right is the absolute foundation for every single coding decision you're about to make.
A psychiatric diagnostic evaluation is way more than just a chat. It is a deep, comprehensive dive into a patient's entire world. The provider is looking at everything: the biological, the psychological, and the social factors. That's what biopsychosocial means. The whole goal is to piece together a puzzle to get an accurate diagnosis, and then build a solid treatment plan. Really, it's the blueprint for all the care that follows.
Now, as a coding student, this slide right here, this is your treasure map. When you're reading a provider's notes, you are hunting for these four specific things: a detailed patient history, a mental status exam, the provider's clinical impressions, and finally, their recommendations for treatment. If you can find documentation for all four of these, you are definitely on the right path.
Okay, so you've looked at the notes, you've confirmed it's a diagnostic evaluation. Perfect. Now we get to the main event, the big fork in the road, the single most important question you have to answer. Were medical services involved? Because the answer to that question is what separates our two key codes.
And here it is, plain and simple. The entire difference between 90791 and 90792 boils down to this one thing. 9791 is without medical services. 9792 is with medical services. That's it. Your job is to be a documentation detective and find the proof of those medical services or the lack thereof.
So let's zoom in on 90791. This code covers that whole biopsychosocial assessment we talked about. It can even include talking with family or ordering some studies. But, and this is the big one, there's absolutely no medication management and no physical exam. If you read the note and those two things are missing, you're squarely in 90791 territory.
Now let's look at its partner, 90792. This code includes everything from 90791, but then adds that medical layer. This is where you'll see documentation of a physical exam. Maybe a prescription was written or lab work was ordered. When you see those elements in the notes, a little light bulb should go off in your head that says, aha, this sounds like 90792.
Knowing the difference is half the battle, right? But now we need to talk about the rules of the road, how to actually apply these codes correctly so you can create clean claims that get paid and, most importantly, accurately show what the provider did.
Okay, here's a rule you cannot forget. It's simple, but it's mighty. You can only report one of these diagnostic evaluations, either 9791 or 9792, per patient per day. That's it. Just one, no exceptions. It's because this is a huge, comprehensive service, and it's meant to be billed just once to kick things off. So what happens if the patient can't actually be there for the evaluation? You know, maybe it's a small child or an adult who isn't able to participate. Well, CPT has a rule for that. If the provider meets with family or a guardian instead of the patient, you still report the service as if the patient was there. And here's a little insider tip. If the provider then sees the actual patient on a different day, you can bill for that evaluation too.
Let's be real, not every evaluation is simple. Sometimes things get complicated. The provider might have to deal with communication barriers, like using an interpreter, or managing a highly distressed patient, or navigating conflicting stories from family members. When that happens, there's an add-on code for it, 9785, for interactive complexity. Just keep that one in your back pocket for those extra tough sessions.
We've spent a lot of time on what you should do, but honestly, knowing what not to do is just as important. Understanding these exclusions is going to save you so much trouble and help you avoid denials right from the start of your career.
Whoa, okay, stop right here. This is a big one. These codes, 90791 and 90792, are for evaluation. They are not for treatment. Psychotherapy is treatment. You simply cannot bill for both on the same day because they have totally different goals. One is about diagnosing the problem, the other is about treating it.
And just to be super clear, you cannot report a diagnostic evaluation on the same day as crisis psychotherapy or applied behavior analysis. Think about it this way. A diagnostic evaluation is like the architect drawing up the blueprints for a house. Psychotherapy is the construction crew actually building it. You don't do both at the exact same time.
And here's another huge rule, and this one really applies to 9792. A provider can't bill for a diagnostic evaluation and a separate EMM service, like a regular office visit, on the same day. And why is that? Well, because all the necessary medical work is already included in the 9792 code. Billing for both would be like trying to sell someone a car and then charging them extra for the engine. It's already part of the package.
We have covered a lot of ground, so let's boil it all down. Let's zoom out and focus on the one single solitary idea that matters most. If you remember absolutely nothing else from this, please remember this.
Here it is, the golden rule. These codes are for a specific moment in time. They are for that initial diagnostic deep dive or maybe for a major reassessment down the line. They are not for the regular ongoing work of therapy. These codes represent evaluation and evaluation only. That is your North Star.
Okay, so let's bring it all home. The next time you see a chart that documents a psychiatric diagnostic evaluation, what is the very first thing you're going to look for? What's that one question you're going to ask yourself as you read through those notes? If you know the answer to that, then you've absolutely nailed the heart of this lesson.